Thomas Bolky was last my guest in September of 2020, and the subject at the time was vaccine nationalism. He's the director of the Global Health Program and senior fellow for Global Health Economics and Development at the Council on Foreign Relations. It's the perfect day for him to return to the program because page one above the fold in the New York Times, missed chances to share doses in poor nations. When Thomas Bolky was last here, he had recently written the following: absent an international enforceable commitment to distribute vaccines globally in an equitable and rational way, leaders will instead prioritize taking care of their own populations over slowing the spread of COVID-19 elsewhere or helping to protect essential healthcare workers and highly vulnerable populations in other countries. Perhaps he was prescient in this instance. I should mention that he just testified a couple of days ago before the House Foreign Affairs Committee on global inequity in COVID-19 vaccine distribution. Thomas Bolky, welcome back. It's nice to have you here.
My great pleasure. Thanks for having me again.
So what has been our approach? Has it been an America first approach? And has there been any difference on this issue, the issue of vaccine nationalism, between the Trump and the Biden administrations?
So right now, wealthy democracies are largely giving cash instead of doses. We're in the midst of the largest vaccination campaign in world history. We have, in just the first 4 months of the rollout of this vaccine, vaccinated or administered doses to more than 400 million people globally. 3 out of 4 of every dose administered in just 10 countries. So most of the world has very little vaccine access. There's 80 countries that have yet to administer a dose. What we're seeing is countries that have early supplies are prioritizing their domestic population first prior to figuring out how to address this globally. The exception are autocracies. Russia, China, a handful of other nations are donating doses, but mostly to countries that are economic partners or where they have strategic interests.
So this is the situation that you warned against, true?
It is. We had that conversation back in July, and I recall you were on top of this issue back then too, saying that this is the biggest story people aren't paying attention to, and sadly we are back 6 or 7 months later, and people still aren't paying enough attention to it.
What I remember about it is that I kind of understood it with regard to President Trump, because it seemed like it was out of his America First playbook. And what I remember is that after you alerted me to this issue with your writings and your research, I remember via CNN going to the Biden campaign and asking them for a policy statement or some type of position, and not being able to draw any kind of a response. So I guess what I'm hearing from you is that the Biden administration on this issue pretty much adopted the Trump playbook. Is that fair?
There's one big difference. So the Biden administration has withdrawn the withdrawal notice of WHO membership. So the US will remain within the World Health Organization. We've also committed to giving money to the multilateral initiative that the World Health Organization has organized to distribute doses. Both of those steps are steps that the Trump administration hadn't done. But with regard to actually giving doses, we've been much more in line with what the previous policy had been, rather than shifting from that.
I read your testimony that you presented to the House Foreign Affairs Committee, and your thesis seems to be that uneven or delayed global access to proven COVID-19 vaccines threatens core U.S. strategic interests. And you just told my radio audience a moment ago that these are autocracies that are doing it different than the Western world. And I guess your argument, in addition to other things, is to say they're seizing the moment and trying to build new relationships. Is that on the right path?
That is exactly on the right path. So we see a handful of countries that have begun donating doses. Most of them are either autocracies or nations that we consider to be autocratizing, so where their democracies are in decline. China is a great example. They are donating, they say they're going to donate to 80 countries. So far, they've donated to 46. 45 of them are Belt and Road Initiative countries. Russia is also donating, but almost exclusively through oligarchs giving gifts to individual countries or Russian firms. Most of the donations that they're providing right now are small. The average Chinese donation is fewer than 300,000 doses. Same for India. Again, they are not targeting where the coronavirus crisis is the greatest or where these doses can do the most good. They're targeting countries where they have diplomatic interests, such as, countries in the South China Sea or countries with natural resources.
So I guess the difference between the two is those autocrats don't have to stand before the electorate. I mean, Vladimir Putin doesn't have to worry about whether voters will approve of his handling, but in democratized countries, the decision, the calculus must be that the voters wouldn't go for this, that the voters would want a UK first policy or fill in the blank, a Germany first policy or a United States first policy. In anticipation of your being on the program before the top of the hour break that introduced this segment, my last caller was someone who said, hey, I think we should vaccinate all Americans before we start sharing our doses with the rest of the world. What would be your response to a caller like that?
Yeah, so it's understandable. It's understandable that people want us to vaccinate domestically before we start moving internationally. And clearly, Democratic leaders hear that. Every dose sent right now abroad is a one dose fewer that can be administered at home. But here is the reason why eventually that becomes the wrong approach. It's understandable that any nation that has doses should prioritize high risk populations, health workers, essential workers. We are going to quickly start moving past that population in the rollout of this vaccination campaign. And we're going to start vaccinating low risk members of our population. That ultimately is not going to make Americans as safe as sending doses abroad in a way that helps us get this pandemic under control. And here's why. We are not going to be able to achieve anytime soon herd immunity with vaccination alone. The reason for that is ultimately, and again, a reminder for your audience, herd immunity is being able to have enough people with immunity that if you were to become infected, you're less likely to find someone else who would be susceptible to that infection, so it gets spread. It burns out. That's the idea with herd immunity. The reason why we're not going to do that is we can't vaccinate children. We can't vaccinate them until this fall. That's 70 million people in the United States right there. Ultimately, there are a number of individuals who also are, for whatever reason, going to delay or refuse vaccination. So that adds a number there. The goal of vaccination at this point is protecting vulnerable, high-risk individuals. And that's true globally. If we do not do that, we're going to see the more of an emergence of variants of concern. We're going to see health systems and economies collapse abroad, and that really affects core American interests.
Okay, so it's a twofold argument that Thomas Bolky is making. One is to say that we may lose some relationships to our detriment because China and Russia are seizing the moment and befriending other countries by making their vaccines available. The second is a medical argument, which is that we'll be delayed in our attainment of herd immunity. The world's flat, to take Tom Friedman's words, especially when it comes to virus. And what goes on over there, wherever over there might be, is ultimately going to come back and harm us.
That's exactly right. So both of those interests are at play here, that ultimately where doses from China and Russia go today, their influence may follow. That puts the US at a disadvantage. And the world is flat with regard to infectious diseases. And unfortunately, this virus travels quickly across that surface. And what we're seeing with variants is a real risk to the United States. Ultimately, if more contagious, more deadly, more resistant variants of this virus emerge, it's going to undermine our vaccination campaign. The only effective way to stop that is to reduce the spread of the virus globally.
The Times today, from the front page story, Western success has created stark inequity. Residents of wealthy and middle-income countries have received about 90% of the nearly 400 million vaccine delivered so far. Under current projections, many of the rest will have to wait years. I was about to say, won't this all be moot in about 2 months' time? Because I've heard the president say, and others associated with the administration, that anybody who wants to have a vaccine in the United States within the next 2 months will be able to get it. And by the way, to your earlier point, in terms of moving beyond those who are most vulnerable, today in Florida, 50 and older, you can now go get the vaccine. So what of the mindset that when there's so much of the vaccine in the United States, well, then we'll share it? Are you saying that 2 months from now is too late?
Well, it's not clear we're going to donate 2 months from now either. And that remains an open question. So ultimately, because of this variant issue, we don't know when we'll be able to start to donate doses if our goal is to vaccinate every American adult. The reason why is ultimately if these variants spread more easily, that means more people can get it more easily. We need to vaccinate a greater percentage of the US population to achieve these public health goals. So that's one hurdle. Plus, some of these vaccines may have different levels of effectiveness against different variants. We're really not going to know the answers to that by and large until the summer. So that may further delay doses too. But again, ultimately, if this is spreading abroad, we see more variants emerge. It's going to undermine the progress we've made with this vaccination. We are reaching the point now where we really need to get this pandemic under control to make us safer, not just vaccinate, low risk individuals in their 20s to have that happen.
So let's sum up. We've been writing a check up until now. To whom have we been writing the check? Because no matter how much money you might give away, there's only so much vaccine that has been produced. So what is being done with that money?
So the US in late December, Congress appropriated $4 billion as a part of that spending package that went forward on December 29th. That is going to go to the global vaccination effort. 2.5 million of that 4 million is going to be to buy vaccines. 1.5 billion is going to be to distribute them. You are spot on, Michael. The challenge is that ultimately there are no vaccines to buy right now. They've been bought up in advance. So we're making more, but it's going to be some time. The goal of this multilateral initiative, this COVAX, is to distribute 2 billion vaccine doses by the end of the year. They've only distributed 29 million so far, and we're 4 months into this vaccination campaign. They need to see exponential growth, but there isn't the vaccine available to do it now, and there aren't the raw materials and all the single-use components that you use to vaccinate people. None of that is available either. We really need to start to shifting from thinking about a mentality of giving cash to start to thinking about what can we do to build supply.
What kind of reception, final question, did you receive on Capitol Hill last week?
So I will tell you, on the House Foreign Affairs Committee, it was a 3-hour hearing. We had 40 to 50 members show up, and they really are engaged. People are worried about what is going on with vaccine diplomacy with China and Russia, and to some extent India, and when the US is going to engage in this space. So I really think people get it. We need to see more from the administration on this issue, and I want to be blunt about that. We saw a loan going to Mexico and Canada around vaccines for the AstraZeneca. We need to see more about what we're going to do globally.
Thomas Bolky, that was great. Thank you so much, and I appreciate your coming back to explain this issue again.
My great pleasure. Thanks for staying on top of this.